Hey guys, and welcome to How to Gastro. So in today's video, we'll be discussing what is the creatinine blood test. So this blood test is also commonly ordered together with the UNE, usually in the emergency department. So I have just done a video on the urea and electrolytes blood test, and it was posted yesterday. So if you guys want to watch that video in conjunction with this video, it will probably be super helpful to do so. But anyway, let's dive into today's video, which is all about the creatinine blood test. So let's get started. So before we get into the specifics of the creatinine blood test itself, let's talk a little bit about what you can expect when your doctor orders this blood test for you. So a creatinine blood test is a simple test that can be done at your closest laboratory or hospital. No special preparation is needed for a creatinine blood test, which means you don't have to fast, so you can eat and drink as usual before the test. So during the test, a blood sample will be collected from you, which means a needle will be inserted into a vein, usually in your arm, to draw out some blood into a gold top or SST blood tube. This blood tube is then sent off to a laboratory where it is analyzed and resulted. So what is creatinine? So creatinine is a waste product that is generated from the normal breakdown of muscle tissue in the body. So creatinine is produced from creatine, which is a compound involved in energy metabolism in muscles. And as muscles break down, creatinine is released into the bloodstream. So it's a small, relatively stable molecule. It is directly related to an individual's muscle mass, and it is filtered out of the blood by the kidneys. So the measurement of the creatinine levels in the blood is commonly used to assess kidney function. So if we take a closer look at this image to the left of our screen, it says, where does creatinine come from? So we have our little bodybuilder here, and he says, you wish you had this much creatine. So remember, this creatinine comes from this creatine, which is produced in the muscles as part of the normal metabolic processes that occur within the muscles. And so on a regular basis, we have creatinine, which is released into the bloodstream, which is quite a small but stable molecule, and it is only filtered out or removed from the body by the kidneys. So the creatinine molecules find their way to the kidneys, where they are filtered by the kidney and then excreted out of the body through the urine. So any sort of kidney dysfunction means that this creatinine won't be able to be filtered out of the body, which means we will have increased creatinine levels in kidney failure. So it says here, but in kidney failure, your blood creatinine level will go up. And now we understand the process of how this actually happens. So now let's talk a little bit about the creatinine blood test. So what is a creatinine blood test? So a creatinine blood test measures the amount of creatinine in your blood. It is a common test used to assess how well your kidneys are functioning. So here's why doctors may order a creatinine blood test for you. Number one is to evaluate kidney function. So the primary purpose is to determine how well the kidneys are filtering creatinine from the blood, and elevated levels of creatinine can signal impaired kidney function. Number two is to monitor kidney health. So the test is often used to monitor kidney function in individuals with conditions that affect the kidneys, such as diabetes or hypertension. And the third reason is to assess kidney disease progression. So for those who are already diagnosed with kidney disease, the test helps track the progression of the disease or the effectiveness of treatments. So now that we know what this blood test is all about, let's take a closer look at the normal range of creatinine in the blood. So the normal range of creatinine levels in the blood can vary slightly depending on the individual's personal factors, such as age, sex, muscle mass, and overall health. However, the general reference ranges are as follows. So in men, a range from 0.6 to 1.2 milligrams per deciliter of blood is considered normal. In women, a range from 0.5 to 1.1 milligrams per deciliter of blood is considered normal. And in children, the ranges are typically lower, often ranging from 0.3 to 0.7 milligrams per deciliter, but this can also vary based on the age and the body size of the child. So this is what the normal ranges look like, and now let's take a closer look at some abnormally high and abnormally low ranges of creatinine in the blood. So abnormally high creatinine levels in the blood can be indicative of a number of health issues, primarily related to kidney function. So when the kidneys are not working effectively, creatinine can accumulate very quickly in the blood. So here are some potential causes of elevated creatinine levels. So coming in at number 1, we have chronic kidney disease. So this is a progressive loss of kidney function over time, and conditions like diabetes and hypertension can both lead to chronic kidney disease, causing elevated creatinine levels. At number 2, we have acute kidney injury. So this is a sudden loss of kidney function that can result from various factors, including severe dehydration, infection, or blockage in the urinary tract that can also cause high creatinine levels. At number 3, we have kidney stones. So stones can obstruct the urine flow, leading to a buildup of waste products, including creatinine in the blood. So continuing with causes, at number 4, we have glomerulonephritis. So this is the inflammation of the glomeruli, which are the filtering units of the kidney, which can impair their ability to filter blood effectively and thereby raise creatinine levels. At number 5, we have a urinary tract obstruction. So blockages in the urinary tract, such as from tumors or an enlarged prostate in males, can also cause increased creatinine levels. At number 6, we have dehydration. So severe dehydration can concentrate the blood and temporarily elevate creatinine levels. At number 7, we have rhabdomyolysis. So this condition involves the breakdown of muscle tissue, releasing high levels of creatine and creatinine into the bloodstream, which can lead to elevated levels showing up on a blood report. And finally, at number 8, we have the use of certain medications and supplements. So some drugs, including certain antibiotics and chemotherapy agents, can affect the kidney function and can lead to increased creatinine levels on a blood report. So now that we've explored all the causes for abnormally high creatinine levels in the blood, let's take a closer look at what are the causes for abnormally low levels of creatinine. So abnormally low creatinine levels in the blood are less common than high levels, but can still provide valuable insight into an individual's health. So low creatinine levels can sometimes be indicative of specific conditions affecting the body, including number 1, reduced muscle mass. So since creatinine is a byproduct of muscle metabolism, individuals with a lower muscle mass due to aging, muscular dystrophy, or malnutrition may have lower blood creatinine levels. Number 2 is severe malnutrition. So inadequate protein intake or malnutrition can lead to decreased muscle mass and consequently lower creatinine levels on a blood report. Number 3 is pregnancy. So during pregnancy, especially in the second and third trimesters, increased blood volume and kidney filtration rates can lead to lower creatinine levels showing up on a blood report. Continuing with causes for abnormally low creatinine levels, at number 4, we have certain medical conditions. So conditions that affect the muscle mass or function, such as advanced liver disease or some types of cancer, can also result in low creatinine levels. At number 5, we have overhydration. So excessive fluid intake can dilute the blood, potentially leading to lower creatinine levels showing up on a blood report. And finally, at number 6, we have end-stage kidney disease. So in some cases, very early stage kidney disease, might not yet impair the kidney's ability to filter waste significantly, which could be reflected in lower creatinine levels on a blood report. And so the take-home message. So as we have just seen, the creatinine blood test is a vital tool for evaluating kidney function, diagnosing potential kidney issues, monitoring ongoing kidney health, and making informed clinical decisions. Regular monitoring, especially for at-risk populations, helps in the early detection and management of kidney-related problems. And that brings us to the end of this video. So thank you guys so much for watching. I hope you found this video very interesting and informative. Please make sure to like, comment, subscribe, and share this video with some of your friends in the medical community. So if you want to encourage me to do even more, or to say thanks for all the free information you've received on my channel today, you can say thank you by buying me a coffee. So the link to buy me a coffee can be found in the description box below. Take care and have an awesome day further. Bye for now.